You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me. In this episode, I'm going to talk about what dental materials you can use as alternatives when you replace your dental amalgams. If you've been joining the show recently, you know that I'm talking about mercury-free dentistry or dentistry without mercury. I've been revealing the impacts of mercury on health and well-being, looking at some of the research, looking at the symptoms of mercury toxicity. And today I want to talk about safe amalgam removal, but not the process itself, but what we can use as materials to restore your teeth instead of amalgam, and look at the pros and cons of some of those filling materials. Because yes, they're going to be mercury free, but are they a safe and healthy alternative? If you want to know more about holistic dentistry, then you can hop on over to holisticdentistry.au. But for now, let's get in the zone. So what are your options? What materials, what fillings, what products can we use to restore your teeth when you replace your dental amalgam? Well, there's several options available. Now, the trend within dentistry is to create a natural looking smile, and I would agree with that. Tooth colored fillings do look really nice, but are they always the best option? Now, previously, before we had these tooth-coloured filling materials, or in their infancy where they weren't really that spectacular, they weren't that hard wearing and not that suitable to go in back teeth, then the best replacement option was always gold. Now, gold's been used in dentistry longer than amalgam, and has been shown to be relatively biocompatible. Now, biocompatible means that it is in line with your body's biochemistry and it's not going to cause reactions, chemical interferences, or adverse effects on your immune system. Now, gold is not just gold. Gold on its own is very soft, it's malleable, so it means it can be reshaped, and it really wouldn't survive very long in the harsh conditions and under the chewing forces that a filling or a restoration needs to withstand in the mouth. So it's normally an alloy, and that means it's been mixed with some other metal or element to give it certain structural characteristics. Now, these metals are usually palladium, copper, or cobalt, and the actual percentage of gold contained within these fillings will vary from about 2% up to about 92%, but not that much these days. Usually it's about 6%, and that just varies on the manufacturer and the price range desired. The problem with gold is it's really expensive, and the cost of gold restorations tends to fluctuate with the gold market. Also, since it's an alloy, the gold used in dentistry still has that capability to create electrical microcurrents called oral galvanism, and that can interfere. It can cause electromagnetic frequencies. It can interfere with your nervous system and cause other problems. The cheaper gold alloys often have other base metals added, and we really don't know if they can pose problems with your health. German researchers were finding a variety of problems related to the use of palladium, and it's been recommended that there should actually be restrictions placed on the use of that material. But we are modern dentists. We're a modern society, we move with the times, and there are newer materials available on the market today, which are bonded resin ceramics, composite resins, or just composites. The term newer materials refers to those that are being used to fill and restore the posterior, your back teeth. Now, composite materials have been around for about 50 years now. We've been using them predominantly to go in your front teeth that were not subjected to great chewing forces. So these were more of a cosmetic type filling and weren't being asked to withstand a lot of workload. Now, the newer composite materials that we can use in your back teeth have a different structural formulation. There are several types available. Their composition is essentially one of a quartz-filled bis GMA resin. Now, what does that mean to you? It doesn't mean much to me either as your dentist. What you have to look at as a recipient of these materials, unless you happen to be a physicist or your engineer, your main concern isn't the actual chemical structure. The more important question is, are they safe to put in your mouth, and are they going to be as potentially harmful as amalgam? These new composites being used for the posterior restorations have been subjected to hundreds of research experiments all over the world to determine whether they were biocompatible and safe for use in the human body. To date, the data produced by these studies indicates a very high degree of biocompatibility when the fillings are placed properly. A key feature of the composite plastics is their extremely large molecular size, which prevents penetration of the material into your bodily cells. However, some composites contain elements such as aluminium and fluoride that are potentially harmful if they are not properly bound into the materials. There's also been some questions now about the use of bisphenol A, which is part of the bis GMA makeup of the filling. It's part of what allows it to be a soft plastic that can then set hard under the right conditions. So there was research done on the dental sealants and on the composite restoration materials, the filling, and there was concerns that they would release estrogenic components, so like hormone mimickers, hormone disruptors, that could cause cancer. Now, this has led to a great deal of misinformation and even misrepresentation. The study evaluated the release of bisphenol A and bisphenol A dimethyl acrylate from sealants into the saliva. The study did show release of these components from newly placed sealants, which are widely used to cover the grooves on chewing surfaces of back teeth as a decay prevention measure. However, these findings are a serious question because of the methods used. Other studies could not detect any bisphenol A release from 7 different sealants tested, which then questioned the findings of this earlier study that said that the material leaked. Of particular note in the early study is that the composite filling materials were first heated to 100 degrees C, which is the boiling point of water, for 30 minutes, after which they were immersed in an alkaline medium of pH 13 or an acid medium of pH 1. Now, these are conditions that are impossible to achieve in the oral cavity. If I poured boiling 100 degrees C water in your mouth, what do you think is going to happen? If I put something that was pH 13, which is super alkaline, what do you think is going to happen? Or pH 1, which is super acid. Again, what's going to happen? Well, it's going to burn the heck out of your mouth, either thermogenically from the heat or chemically from the reaction. Now, your mouth is not subjected to those conditions. 60 degrees C, very, very hot drink. Most people couldn't tolerate that. Our acidity levels don't get up go that low, and neither do our alkalinity levels. These conditions just don't exist in the oral cavity. In fact, under those conditions, just about anything, including your body tissues, would disintegrate. This study could hardly be considered definitive on the degradation of composite fillings because it's not mimicking normal circumstances. And quite obviously, anyone who cites that study as evidence against dental composites actually hasn't read the study and understood the science properly. There is documented evidence of biocompatibility of dental composites, and it's available in a comprehensive study that was commissioned by the International Academy of Oral Medicine and Toxicology, which are the leading branch of medics, scientists, and dentists in the holistic realm of dentistry. The study was done, there was 2 studies done on the biocompatibility of composites, and the results, when reviewed and peer-reviewed, publicly announced that patients with 8 composites are exposed to lower levels of bisphenol A that are 125 times lower than the exposure considered safe from estrogenic effects, whereas patients with 8 amalgam fillings were exposed to higher quantity of mercuries that were 3 times higher than levels that are considered safe. So basically what that study is saying is that if you've got composite fillings, whether they've got BisGMA, bisphenol A in or not, that the exposure to that product is 125 times less than what is considered an unsafe level. And then if you've got amalgam, you've got 8 amalgam fillings, or 8 composites here, you've got 8 amalgam fillings, you're exposed to higher quantities of mercury, much higher than the safety levels that are considered to be safe. There has been one problem, however, with the use of the newer composites, and that's that sometimes they cause post-operative or post-treatment pain and sensitivity. There's a small percentage of people receiving these fillings that will get thermal sensitivity to hot and cold. And although millions of composite fillings have been placed, the profession is concerned about those individuals. And I think that over time, the problem is that unlike amalgam, where you just mix it up and you squish it in the tooth, smooth it over and you're done, it's not a very technique sensitive procedure. You don't have to have a great technique to be able to place amalgam. Whereas with the tooth colored fillings, we have to prime the tooth. We have to put a bonding layer on. We have to keep everything moisture free, so it's got to be kept dry. We've got to build the filling in small incremental layers, and it has to be set or polymerized. And it's a very, very technique sensitive material. And the problem is if you don't follow the technique to the letter, if you don't get it just bang on, that you can end up with these post-operative sensitivities. However, with the newer materials, the newer bonding agents, the really, really high-grade products that we use in holistic dentistry, this post-op sensitivity is almost minimized, and the majority of patients have these fillings replaced and everything settles down normally afterwards. I mean, yes, you're going to get some sensitivity. You've just had your tooth drilled. That's like having surgery and the tooth's got to recover from that. But I don't think the fillings are so much of a problem anymore. If the dentist is well informed, they use the right bases, the cement, so it's like a liner that helps protect your tooth, and they use the composite properly, then I don't think there's going to be major concerns. In the past, we used to have to put more astringent chemicals on the tooth to get the composites to work, and I think it was these that irritated the pulp, which is the nerve of the tooth, and causing these various post-operative pain and sensitivity problems. Research now shows that if you use things like glass cement or calcium hydroxide products that you paste as the base before putting the filling in, that this is very successful in eliminating or reducing the problem of post-operative sensitivity. Like I said, most people will still experience an initial sensitivity to hot and cold, and that settles over time. We'll often recommend like a desensitizing toothpaste or some anti-inflammatories just to nurture your tooth through. Often if pain or sensitivity persists, it's because there was a very deep, close to the nerve filling or cracking in the tooth, and the tooth was already starting to exhibit some symptoms of further nerve distress that would have been inevitable whether the tooth was treated for a replacement of amalgam or not. It's true for any dental procedure, regardless of the type of material that was placed in your mouth, gold or composite or whatever. You're going to get somebody somewhere who reacts to something that doesn't normally cause problems in other people. So there's no material that is perfect for everyone. The potential for reaction exists for any foreign material implanted into your body. To further delineate what dental materials you may be sensitive to, some dentists advocate using sensitivity or biocompatibility testing, and it's a type of test that it's intended to demonstrate the various materials which is best suited for you. These tests are still controversial. They're worthy of considerations for patients with severe illnesses or compromised immune systems, but I find they're not always that accurate. And these days, because the materials that we use as holistic dentists have been so well researched and tested, we can pretty much narrow it down to one or two types of filling material that are going to be suitable in 99.9% of cases for treatment. Now, we use a product from a German company that has no BIS-GMA. It's very high in its ceramic content, very low in its plastic, no aluminium, no fluoride, no nasties, really beautiful filling material, very hard wearing, lasts well, it's great to work with, it looks nice, get very low post-operative sensitivity. So I think a lot of those problems that we were having with the earlier composites have been overcome. And just like any filling material, there's so many different brands of the material, ranging from a very cheap and cheerful, which are going to have a lot more plastic and a lot less filler, which is the actual stuff that makes it hard, all the way through to the high grade products that we use in holistic dentistry. Now, there are other options. There is a material called glass ionomer, which I will touch on in a bit, and there's also porcelain, a ceramic filling, which we can make that has no plastic, and that gets custom made after taking either an imprint or a 3D scan of your tooth. And we have a ceramicist, a dental technician, who actually makes that to custom fit into your tooth. Now, they're very, very hard wearing, they're long lasting, and they're most suitable for teeth that are heavily broken down, need a large restoration, or have cracking in, as the ceramic helps distribute forces better and it can cover over the bite surface of the tooth and help hold the tooth together. So as I was saying, no dental material is perfect for everyone. The potential for reaction exists, and you can look at testing if you want to. Another option that we've been using as dentists is the placement of temporary or interim fillings. So there may be situations, whether for personal health or financial reason, that we're going to replace a mercury containing fillings with a temporary filling called a glass ionomer. Now, I'll usually only use that material if there's some dubiousness or doubt over whether the nerve in a tooth is going to be able to survive post-treatment. And that would be in a case where there's amalgam, there's decay that's close to the nerve, an amalgam with decay that's close to the nerve, an amalgam that's already close to the nerve because the extent of damage from previous decay was so deep, or if a tooth's got cracking or has already presented with some level of pre-treatment pain and discomfort. Now, I'll use that temporary filling as an interim to tide things over so we can see if the nerve's going to settle, rather than using a more expensive material. This temporizing happens, and then they are replaced with a more permanent material as the health of the tooth or finances permit. Now, how long will a composite filling last? Now, dentists love amalgam because it's just so freaking indestructible. It goes on for a long, long time. And, that's one of its selling points is, well, look, I've had this amalgam since I was a kid and now I'm in my 50s and it's still there. Can we say the same about a composite material? Now, when these studies were first done, the newer composites hadn't been around very long. How can you tell how long it's going to last when they've only been around 10 or 15 years? There are several studies that indicate the wear characteristics are as good and if not better than dental amalgam. Although, the jury's still out, but I think they are very good. I think you can use them in back teeth quite successfully. Now, I've got patients I've been treating for a long time. They've been coming to see me as regulars for 20 years. I've replaced their amalgams during that time, and their fillings are still holding up really well. And this is filling material that we were using 20, 15 years ago that we just wouldn't use now, because I'm like, that filling's rubbish compared to what we now have, and yet their fillings are still looking great. Now, there are several aspects about these materials that if we just take out, the biochemical, biomechanical aspects, well, number one, they haven't got any mercury in. They look nice, number two, so when you smile, you don't have these black, grey or silver areas. It looks like natural tooth colour, and it's sometimes very difficult to tell the difference between where the composite is and where your own teeth are. If we use ceramics or porcelain, then colour matching can be, almost indiscernible to the naked eye, that you just can't tell the difference. The composites don't generate any electrical currents, and they don't help participate in corroding any other metallic fillings or restorations you have in your mouth. You have to drill away less of your natural tooth structure because you don't have to do a special preparation to get an amalgam to lock into your tooth. You don't have to do that with a composite. Now, the end product using these materials can truly be called restorations rather than fillings. Amalgam doesn't restore anything, it just sits in the hole. Now, a composite is actually bonded to the remaining tooth structure. It interlocks to the tooth and helps hold the tooth together. They can be very thermally insulating, which amalgam's not. And with the bases and bonding agents used to place the composite, there's much more protection for the pulp, which is the nerve and the blood supply inside your tooth, and the enameled structure of the tooth, because we don't have to drill so much away. In fact, there is scientific evidence indicating that tooth strength increases with the placement of composite, and the tooth can be restored up to 98% of its original pre-decayed state. Now, one of the big problems with amalgam is it doesn't hold your tooth together. It sits in the hole. So you've now got a hole and you've got tooth structure around it that's unsupported, and that tooth structure will flex and bend under the pressure of chewing, and particularly if you clench and grind, and you will get cracks and fractures of your teeth. Also, your teeth expand and contract with hot and cold. So when they get hot, they expand. When they get cold, they shrink. Yes, they do. That also happens to your dental amalgam. The problem is it expands more and contracts more than your tooth structure, which causes more flexing and more cracking. Whereas the composite fillings, particularly the one that I use or holistic dentists use, it interlocks into your tooth, and it's been thermo-engineered so that it expands and contracts at exactly the same rate of expansion and contraction of your tooth structure. So I always say to my patients, it's like it breathes with your tooth. It becomes part of your tooth. There's such a wide selection of materials available in dentistry that we have got so many suitable alternatives to using metal. I like to not only be a mercury-free dentist, but a metal-free dentist. There are products available that are heat and pressure cured that can give different structural and finishing properties to the final products. And these are the ones that I was talking about that are done in the dental lab. These types of materials are excellent for making metal-free crowns and inlays or onlays, which are the fillings and covers in your teeth, and for cosmetic dentistry applications, such as the very thin laminates called veneers that can be bonded onto your teeth. And these can be done with little or in some cases no tooth preparation. And these are great to cover over bad stains, to close the little spaces between your teeth, to smooth out irregularities, to rebuild areas that are chipped or worn. There are also porcelain laminates and veneers being used for cosmetic applications, and there are also metal-free ceramic and all glass crowns available. So we've got so many choices now. And the trend in dentistry as we move more and more towards being totally metal-free means that these materials are where all the research is happening. It's where all the leading edge of technology is happening. And so we're constantly getting improvements in these materials. When I first started dentistry, I'm giving my age away, back in the late 80s, graduating in early 1992, when we were using ceramic, you basically only had two choices. It was layered onto metal, and I say you only have two choices. A, it was layered onto metal. You had no choice. No, you did. Sorry, I'll just take a breath. You had two choices. You had porcelain on its own, which was okay as a cosmetic. It was too brittle and they didn't have a lot of strength. You couldn't use them on back teeth, only on front teeth. It's called a porcelain jacket crown. And the range of colours was very limited. You kind of had light, medium and dark in a sort of creamy yellow shade. Or you had porcelain fused to metal to try and give it more strength, and this was commonly used on back teeth. And I see those in patients' mouth, and they're the crowns that end up giving you a dark ring at the edge because you can see the join of the porcelain, metal and tooth. And also the porcelain was still weak and would fracture off the metal. Again, we didn't have a lot of shade. Teeth were very opaque and looked kind of like dead tombstones in the teeth, but they were better than anything that we had at the time. Now the porcelain can be metal free. It's very strong in the way it's heat treated and compressed, and the range of shades, translucency, transparency, the artistry that can go into these materials is quite phenomenal. It's really exciting to see what can be done and know that these materials are metal free and that they are safe and biocompatible. For far too long, dentistry has relied on toxic metals in the oral environment because there was just nothing else available. However, we can't use that excuse. We can't say composites are no good in back teeth. We can't say we can only use metals in back teeth because we have alternative materials. As the technology and scientific advances have been there and they are still there, the variety of non-metal materials that can be used instead of the traditional materials has so many options for us to consider. I cannot believe that there is any justifiable reason from any angle within dentistry other than it's cheap and it's easy to use and I don't have to have a lot of skill, aka I can't be bothered to upskill and learn how to use these materials and take the time to do them properly. There is no excuse for using dental amalgam. None whatsoever. The argument of, you have to have amalgam because it's a back tooth. That's a lie. You have to have amalgam because there's so much tooth structure missing. Another lie. Composite materials are now suitable for back teeth and have been for the last 2 decades, if not slightly more. Ceramics give us the solution if your tooth is heavily broken down to be able to pretty much restore anything these days. So I don't think that argument for amalgam holds sway anymore. And there's certainly no place in my mind or in my practice or in your body for placing anything that contains mercury or anything that is known to be toxic. So when it comes to your choices for amalgam replacement, there are so many materials that we can use. And this is why it's super important that we see you for a proper consultation. We assess the situation. We have a look at the depth, the size, how many surfaces are involved with the amalgams. We have a look then at the structure of the remaining tooth, your bite loading, any uneven forces, wear and tear, the stresses and strains on those teeth. And by using that and our years of experience and expertise, we can prescribe and recommend the best material and the best way of restoring that tooth so that A, you have a non-toxic filling in your mouth, and B, you're going to have something that's hard, long-lasting, long-wearing, and very functional, as well as aesthetically beautiful. I'm Dr. Rachel Hall. This is the Dental Zone. Thank you so much for joining me. If you'd like to know more about holistic dentistry, hop on over to holisticdentistry.au. If you'd like to see me to get amalgam removal or to have any of your dental health concerns addressed, then you can visit my clinic here in Brisbane, Australia. We're called Evolve Dental Healing. You can Google that, and we've got a very comprehensive website for you as well. You can check out more of our podcasts. You can check out my YouTube videos, or you can give my clinic a call on 07 3720 1811 and book in for a consultation, and I'll be very happy to see you and help you out. Thank you very much for joining me. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.